All right, today we're going to tackle something that, well, let's be honest, drives pretty much all of us crazy: the US healthcare system. It feels like this giant, expensive maze, right? So let's see if you can find our way through it together. I mean, have you ever felt like just getting healthcare is a full-on obstacle course? It doesn't matter who you are. From the moment you try to book an appointment to that final, confusing bill, it's less about getting better and more about, I don't know, some kind of high-stakes game. So that's what we're going to do. We're going to walk through this course, hurdle by hurdle, and figure out how on earth it got so complicated. Okay, so first things first. You know the race for good health? It doesn't actually start the day you feel sick. For millions of people, the starting line is way, way back, and it's set by things that have absolutely nothing to do with a doctor or a hospital. Yeah, there's a term for this: social determinants of health, and it really changes how you look at everything. We're talking about things like how much money you make, where you live, who you have around to support you. I mean, think about it. If you don't have a reliable car to get to the doctor, or if you can't afford healthy food, those are huge barriers to care before you even think about picking up the phone to make an appointment. All right, so let's say you've made it past all that. You're in the doctor's office, you have a diagnosis, and there's a plan. You'd think that's the hard part, right? Nope. The next hurdle pops up almost instantly. You now have to get permission from your insurance company for the exact care your doctor just told you that you need. That's called prior authorization. And this isn't just annoying paperwork. This is where things get really, really serious. Get this. The American Medical Association found that nearly 1 in 4 doctors say these delays have led to a serious adverse event for one of their patients. Just let that sink in for a second. We are talking about actual preventable harm being done to people because of administrative red tape. And the burden this puts on the whole system, it's just massive. Doctors and their staff, on average, spend 12 hours a week, just dealing with this stuff. That's basically a day and a half of their work week gone. Time that could have been spent, actually caring for patients is just lost to phone calls and forms. And it's not just doctors who are fed up. We are too. The public is overwhelmingly worried about this. A poll from KFF found that 73% of Americans see these insurance delays and denials as a major problem. And that's across the board. Republicans, Democrats, Independents, it's one of those rare things pretty much everyone can agree on. Okay, on to the next obstacle in our maze. You've jumped through the prior auth hoop. Now you ask what should be a really simple question: so how much is this going to cost me? Well, in the American healthcare system, that question is, bizarrely, almost impossible to answer. Now, the government did try to fix this. They rolled out these price transparency rules. The goal was great, right? Empower you, the consumer, by showing you the costs up front. But the reality? Well, a lot of hospitals just aren't doing it. Compliance is super low, which means for most of us, the price is still a total mystery. So, what's the end result of all this complexity and mystery? Well, this chart says it all, and it's pretty staggering. The US spends more than twice as much per person on healthcare as other wealthy countries. I mean, look at that gap. We're paying so much more, but the big question is, are we actually getting better care for all that money? So you gotta ask, where is all that extra money going? This breakdown is so revealing. About 30% of that excess cash we're spending goes to administrative costs. Yep, all that paperwork, the complex billing, the prior authorizations we were just talking about. And then you've got other big chunks going to higher pay for doctors and nurses, and of course, much higher prices for prescription drugs compared to other places. All right, now for what feels like the final boss battle of this whole obstacle course. You've had the procedure, you're back home, you're recovering, and then the mail comes. You open an envelope, and there it is. A bill for a shocking amount of money from a doctor you don't even remember meeting, who turns out to be out of network. The dreaded Suprise Bill. So to deal with this nightmare, Congress passed the No Surprises Act. And look, the goal was fantastic: to protect people like you and me from these bills that could literally ruin you financially. And for patients, for the most part, it's actually worked. But that's not where the story ends. Here's the twist. While the law protected us, the patients, it basically just created a brand new battleground for the doctors and the insurance companies to fight it out over who pays the bill. It's a new, complicated system designed to fix a problem from the old, complicated system. You see the pattern here? And has this new system been busy? Oh yeah. Just look at this number. In 2024 alone, this new dispute process was used more than 1.46 million times. That's Wow, that is more than double the number from the year before. It's exploding. So, who's kicking off this flood of disputes? Is it the insurance companies? Nope. And this is the key detail. Over 99% of these cases were started by the healthcare providers, not the insurers. It's the doctors and hospitals who are really using this new system to push for bigger payments. And is it working for them? Are they winning? The answer is a big yes. Providers won about 85% of these disputes in 2024. So the takeaway is pretty clear. They are using this new tool a lot, and they are winning a lot. You know, all these little fixes and new rules, it feels like we're just constantly putting patches on a system that's full of holes. So let's zoom out one last time and look at some of the really big ideas for trying to get control of this runaway train. One of the biggest tools we have comes from the Affordable Care Act, and you can think of it like a safety rule. It basically says insurance companies have to spend at least 80 to 85 cents of every dollar you pay in premiums on actual health care. If they spend too much on their own profits or marketing or whatever, they fail the test. And if they fail, they have to give some of that money back to you as a rebate. And believe me, this rule has real teeth. For 2024, the estimate is that insurers might have to pay back over $1.1 billion to people, all because they didn't spend enough of our money on actual care. It's a really important way to keep their profits in check. So what's the next big fix on the horizon? Well, the government is turning to artificial intelligence. Yup, AI. The Department of Health and Human Services has a whole new strategy to use AI for everything, from medical research to simplifying billing. The hope is that maybe, just maybe, technology can finally slice through all this red tape. And that brings us right back to where we started, with this one huge critical question. We have rules to fix other rules, laws to fix other laws, and now AI to fix all of that. With every new solution, are we actually making this maze any easier for people to navigate, or are we just building new, more complicated walls? I'd really love to know what you think.